Union Home Ministry writes to all states and union territories to ensure compliance to the Supreme Court's directions on welfare of migrant labourers housed in relief shelters. Availability of essential commodities under control as several ministries work in coordination with state governments to resolve logistical issues. Union Health Minister Dr. Harshvardhan holds a review with Council of Scientific and Industrial Research through video conferencing about the steps undertaken by CSIR and its constituent 38 labs towards mitigation of coronavirus outbreak in the country. Says CSIR scientists are to develop COVID-19 mitigation solutions keeping fixed time frame in mind. Active COVID-19 cases across India rise to 7,987 with 308 fatalities and 856 recoveries. Government focuses on increasing testing facilities, says no need to panic as the government is planning things so as to effectively manage the situation. Number of hotspots in Delhi goes up to 43 with a few more localities added as containment zones. High-risk zones and containment zones are being sanitized starting today in the national capital. COVID-19 cases across the world continue to spiral up. Over 18,50,000 cases registered globally with over 1,14,000 deaths. US President Donald Trump signs presidential disaster declaration for all 50 states in the wake of COVID-19 outbreak, while the US records 1,514 virus deaths within the last 24 hours. UK Prime Minister Boris Johnson is discharged from hospital. Namaskar, you're with the latest here on DD News and DD India. I'm Gautam Roy. Now, India's response to contain COVID-19 has been proactive and the government has followed a graded approach. Focusing on increasing testing facilities, the government has said that there is no need to panic as proper planning is being done to effectively manage the situation. Further, in coordination with the states, the centre is ensuring supply of PPE, N95 masks, testing kits and ventilators, as well as dedicated COVID hospitals are also being set up to provide proper treatment. The figure of active cases has risen to 7,987 with 308 fatalities and 856 people discharged so far. Now, in view of the Supreme Court's directions regarding welfare of migrant labourers housed in relief shelters as well as camps in different parts of the country, Union Ministry of Home Affairs has written to all states and union territories to take necessary action in compliance with all the directions of the court while implementing lockdown measures to fight the COVID-19 outbreak effectively. The court directed that adequate medical facilities besides proper arrangements for food, clean drinking water and sanitation be ensured for migrant workers at relief camps and shelters across the country. Further, trained counsellors or community group leaders belonging to all faiths should visit the relief camps and shelters and deal with any consternation that the migrants might be going through. The court also observed that the anxiety and fear of the migrants should be understood by the police and other authorities and that they should deal with the migrants in a humane manner. Union Health Minister Dr. Harshvardhan yesterday held a review meeting with Director General of a Council of Scientific and Industrial Research, Shekhar Mande, and all the 38 CSIR lab directors. During that meeting, the Health Minister exhorted scientists to develop COVID-19 mitigation solutions keeping a fixed time frame in mind. He added that these are times of war and we need to deliver solutions before the war ends by not treating this as a routine research project. Dr. Harshvardhan said genetic sequencing was crucial in eradicating polio and it will help in COVID-19 mitigation as well. During the meeting, CSIR DG said core strategy group has been set up and 5 verticals have been identified under which coronavirus-related activities are being carried out. These include digital and molecular surveillance, rapid and economical diagnostics, new drugs and repurposing of drugs and associated production processes, hospital assistive devices and PPEs, and supply chain and logistics support systems. Dr. Mande also mentioned that 15 CSIR labs are working in close partnership with major industries, PSUs, MSMEs and other departments and ministries at the time of crisis in the country. The Health Minister appreciated that CSIR labs are also conducting tests of swab samples of coronavirus patients, and some of them have started doing genetic sequencing of the virus with a target of doing 500 sequencing in the coming weeks. He also appreciated the work done by CSIR NAL with BALE and BEL on ventilators, oxygen enrichment devices, and also developing 3D printed face shields, face masks, gowns and other protective equipment, adding that all these things will help us in the next few weeks. Now, the Delhi government has identified 3 more areas as containment zones in the national capital. The number of containment zones in Delhi now stands at 43. Southeast Delhi is the highest number with 12 containment zones. The total coronavirus cases in Delhi has risen to 1,154 according to the latest data from the Health Ministry. 24 people have died in the state so far from coronavirus, while 27 have been cured or discharged. Now, all the central ministries have started work, that is resumed work today, with standard operating procedures of social distancing. Post-lockdown, all the work was being carried out through video conferencing, but now staff will be attending offices on a rotational basis. The meeting, called by Union Information Broadcasting Minister Prasar Bharati, was attended by Secretary and Joint Secretary. And speaking at the meeting, the minister said that media professionals are frontline warriors just like doctors and police personnel.
कोविड महामारी के खिलाफ देश लड़ रहा है और प्रधानमंत्री जी के नेतृत्व में उसमें हम विजयी होंगे। इसमें जैसे डॉक्टर, नर्सेस, सफाई कर्मचारी, पुलिस कर्मचारी, सरकारी कर्मचारी, बैंक के कर्मचारी, वैसे ही मीडिया के कर्मी जो है वो भी एक तरह से फ्रंटलाइन काम करते हैं, क्योंकि लोगों तक खबर पहुंचाना उनका काम है, उसके लिए जगह जगह जाते हैं। तो मेरा पहला आज यही रहेगा कि आप अपना ख्याल करिए।
The minister also added that now is not the time to sensationalize any issue and do any news that does so, and all news must be aired after confirming it from credible sources, just like Doordarshan and Akashvani.
एक आग्रह है मीडिया से कि कोई भी न्यूज़ आती है, सेंसेशनलाइजेशन का ये वक्त नहीं है। इसलिए समझो किसान के बारे में कोई खबर आई तो कृषि मंत्रालय से आप पूछ लीजिए, एक बार चेक करिए। फूड मिनिस्ट्री का कुछ संबंध है, फूड मिनिस्ट्री से पूछिए, होम मिनिस्ट्री से है, होम मिनिस्ट्री में पूछिए, यानी संबंधित मंत्रालयों से पूछे और फिर चेक करके खबर देंगे तो ज़्यादा विश्वसनीय बनेगी। जैसे दूरदर्शन, आकाशवाणी, ये सब सेवाएं ढंग से चल रही है, लोगों तक हम सही खबरें पहुंचाएंगे और आप भी इसी काम में जुट जाइए, यही मेरी अपील है।
Union Youth Affairs and Sports Minister Kiren Rijiju joined back office today, and speaking to news persons, all the guidelines regarding COVID-19 will be followed is what he said, and only senior officials and minimum required staff will be coming to the office.
यहाँ जो सीनियर ऑफिसर्स हैं और जो ज़रूरी है वही आएंगे, बाकी स्टाफ तो अभी आएंगे नहीं। बहुत ही ज़रूरी वाला स्टाफ और सीनियर लेवल ऑफिसर्स, उसके साथ में हम लोग ऑफिस को चला रहे हैं और 9:30 सुबह से हम लोग ऑफिस चलाने का जो पहले पुराना सिस्टम है वही करेंगे, लेकिन बहुत ही केयरफुल होगा, सब जो गाइडलाइंस है वो मेंटेन करते हुए।
And let's now take a look at this video which tells us all about Arogya Setu app. Arogya Setu is a mobile app developed by the Government of India to connect essential health services with the people of India in our combined fight against COVID-19. The app is aimed at augmenting the initiatives of the Government of India, particularly the Department of Health, in proactively reaching out to and informing users about the app regarding risks, best practices and relevant advisories pertaining to the containment of COVID-19. Now, the World Health Organization's chief scientist, Dr. Soumya Swaminathan, has hailed the government's Arogya Setu app, saying it informs users about best practices on COVID-19.
Arogya Setu app has been launched by the government, and because of the huge penetrance of mobile phones in India, I think it's a very good tool to use because otherwise you're going to need millions and millions of people going door to door. So if you could use the mobile phone and an app on it to track people with fever, to communicate with them, to tell them where to go for testing, to be able to also track all the contacts to find out where they are, whether they are sick.
Now, doctors from different hospitals across the nation have shared important information related to COVID-19. Listen in.
As a nodal officer being actively engaged in patient care activities, what I have observed till now is patient requires more of a counseling beyond medications. Whenever a patient comes to us in our first contact and in our first reassessment, we always counsel the patient first, assure them that they are all right, they have minor symptoms, they will get well with time. Those patients who are sick, who require ICU care, we continue the same, we tell them it's a normal pneumonia and you will get overcome this too also. So as a physician, it is imperative for us to counsel them, re-counsel, and every visit which we go, we should just assure them that they will get well.
I think I'm fighting this war against corona on 3 fronts. First is the work front, which involves not just managing routine patients, but being available round the clock to sort out residents' queries regarding management and system lapses. Second is the home front. With this lockdown in place, I have to manage cooking, cleaning and washing and concerns of family and friends. Third war front is being ministry representative for public education through Doordarshan. That's the most difficult one for a media shy person like me.
Today, there is no dearth of equipment, manpower or infrastructure. The major challenge, however, is the mindset of the patient as well as the common man. Coronavirus, as we all know, against which we are waging a war today, could be fatal. But let me remind you, friends, that in majority of the cases, the patients return home with healthy bodies and minds.
Now, the entire state of Maharashtra has been badly affected due to the spread of the coronavirus. Maharashtra has registered the highest number of positive cases, with the total number standing at 1,895. Now, on a positive note, over 200 patients have also recovered from the infection, while the Maharashtra government is taking several measures to curb the spread of the virus as well.
The cases of positive COVID-19 is rising daily in the state of Maharashtra, and with 1895 cases recorded, the Maharashtra state is on the highest number in the country. But the good news is 217 people have been cured and sent home. Maharashtra government is taking various measures to curb and to arrest the spread of COVID-19. Like here you can see that in the ground, the entire vegetable market has been set up where people can come, and the shops have been put up at distance, and people in masks and all the necessary precautions have been taken over here. Shama Mishra, DD News, Mumbai.
Now, Meghalaya's defences have held strong against the COVID-19 onslaught, and the state is currently one of the only 2 in the country that is yet to report a single infection. With the state government implementing a lockdown that was more restrictive than the rest of the country, the challenges facing the people are many. But the people have responded so far, and they have responded well to it. Here's a report on one such response.
We're approaching the fag end of the 21-day lockdown in Meghalaya, and the state has been holding its own. Integral to any success the state government can lay claim to is the role of the delivery executive, especially in the initial few days when essential commodity shops were all shut. It's the delivery executive that stepped up to fill this role. We've managed to catch up with one such delivery executive, Mr. Benny Lingdo, and let's find out how he has handled this challenge.
We started this thing 2 days within the lockdown, so we approached the government and all to do the formalities and all, but it took us 2 days to start operation. We had never done like this, anything like this in Meghalaya. So after some time, we got used to it, but then by that time the deliveries have also, like, people have settled down and all that. So meaning there's no more panic buying and all.
It is the ordinary people like Benny Lingdo who saw opportunity in the crisis and helped the Meghalaya government tide over this challenge. This only goes to further show that it is the cooperation and determination of the ordinary people that is integral to the success of any government venture. Reporting for DD News from Meghalaya, this is Gautam S. Kumar.
Now, in the wake of the rising number of the novel coronavirus cases in India and nationwide lockdown, the government of Jammu and Kashmir is taking all the measures in its capacity to provide essential commodities to the masses.
In view of the lockdown, the J&K UT government is taking all the measures which it can do for providing essential commodities to people. Now, the poor people of the UT will be provided 5 kg ration free from food and supplies depots. This will be in addition to the 2 months advance ration being provided to the people in the Union Territory. Talking to Food and Supplies Director Jitendra Singh, he said that the 5 kg free ration will be provided to the poor people from tomorrow.
On the directions of the government, हमें 2 महीने का राशन जो है अप्रैल और मई का वो हमने डिस्ट्रीब्यूशन उसकी स्टार्ट कर दी है और एज ऑन डेट कल शाम तक जो जब मुझे रिपोर्ट आई लगभग 5:30-6 बजे तो हमारे लोगों ने अप्रैल और मई का जो राशन था वो लोगों तक बेनिफिशियरीज तक जो है वो पहुंचा दिया था। इसी तरह से हमारे डिवीजन कमिश्नर साहब जो कि रेड क्रॉस के डिवीजन के चेयरमैन हैं उनकी हिदायत पे हमने 1500 क्विंटल राइस और 1500 क्विंटल आटा जो है हमने डिवीजन कमिश्नर साहब के थ्रू हमने रेड क्रॉस को दिया है जो कि वो लेबरर्स और जो डेली वेजर्स जो हैं उनको वो प्रोवाइड कर रहे हैं, फ्री ऑफ कॉस्ट है ये।
Government has almost completed distribution of advance 2 months ration for the months of April and May among the beneficiaries within a short span of 6 days across all the districts of Jammu division. Furthermore, Food and Supplies Department has kept 1500 quintals of rice and 1500 quintals of atta at the disposal of Red Cross Society Jammu for distribution among the poor and stranded laborers and daily wages free of cost. It is evident that Union Territory government is taking all the steps to ensure that ration and other essentials are provided to people at this critical juncture. R.K. Rana for DD India from Jammu.
Now, in view of the COVID-19 situation, a self-help group in Great Nicobar has made masks and distributed them to villagers of Lakshmi Nagar Panchayat. While maintaining social distancing, BDO in charge, Assistant Commissioner Lalit Tigga, other Panchayat members and volunteers participated in this exercise. They also created awareness about COVID-19 and interacted with people to know more about their problems. From early detection to curbing COVID-19 from spreading further, several districts have been adopting innovative models for the purpose. The Agra model has emerged as the best model for successfully tackling cluster containment. The state, district administration and frontline workers coordinated their efforts by utilizing the existing smart city integrated with command and control center as war rooms. Under the cluster containment and outbreak containment plans, the district administration identified epicenters, delineated impact of positive confirmed cases on the map and deployed special task force according to the micro plan made by the district administration. For reaching out to people, central helplines were established and a multifunctional team was set up for coordinating responses. The cluster containment strategy adopted by Agra is being shared with other states as a best practice. Now, a rumor is being spread these days bothering customers of SBI. In the viral post, it's being claimed that the Reserve Bank of India has shut down the State Bank's Aadhaar-enabled payment system, or the AEPS server. PIB fact-check team has dismissed this message. PIB has said that this claim is false. No such decision has been taken by the RBI. RBI has not shut down the server of the Aadhaar-enabled payment system of the State Bank of India. All viewers are requested not to pay any heed to any fake news and do a fact-check from official sources. The Ministry of Health and Family Welfare has dismissed the media reports stating that preconception and prenatal diagnostic techniques, Provision of Sex Selection Act 1994, has been entirely suspended. The ministry has clarified that only some relaxation has been given to submission of reports in view of the coronavirus lockdown. The rules pertaining to applying for renewal of registration if falling due in the period, submission of reports by diagnostic centers by the 5th day of the following month, and submission of quarterly progress report by states and union territories. The submission deadlines of reports to respective appropriate authorities have been extended till the 30th of June this year. And that's all we have for the moment in this edition of Midday News, but all the latest continues right here on DD News and DD India. Up next, do tune in. It's a call and live program. You can start making your calls. The number will be coming up on the screen as well for Dr. Speak. All your queries answered on COVID-19 outbreak. Stay tuned.